We know the precautions needed to help keep the coronavirus from spreading, but what types of medical treatments are there? Infectious disease consultant for the Hospital of Central Connecticut, Dr. Anyimadu, joins us again. Doctor, thank you for being here.
Thank you for having me.
So what are some of the new medications that are being used to treat COVID-19?
So currently what we have and we are using to treat COVID-19 is a medication called hydroxychloroquine and chloroquine. These are medications that we've had a lot of experience with because we've used it to treat malaria and we've used it to treat rheumatologic conditions as well. But the truth is we don't really know if these medications work. There is some scientific rationale some scientific rationale behind why these medications are being considered, because we know that they are anti-inflammatory, they are also immune modulators, and it's been actually shown in the lab to decrease the replication of the virus. But what we don't know is whether these really work in humans, because as you know, clinical laboratory efficacy of a medication does not necessarily mean it will be clinically effective.
Can you take chloroquine or the malaria drugs as a preventive measure?
At this point, I would say no, because we don't have any data to support the use of these malaria medications to prevent COVID-19. And, you know, these medications are actively being used by some patients who have rheumatologic conditions like lupus, like rheumatoid arthritis. And if we use these medications in attempt to prevent COVID-19, then we'll be diverting the medications from the people who really need them. And there's no data at all to support the use of hydroxychloroquine or chloroquine to prevent COVID-19 at this point.
Sure. Are there side effects to these medications?
Oh, yeah. These medications are not completely benign. So the FDA issued an emergency use authorization for the use of hydroxychloroquine and chloroquine. And it's actually, we're supposed to be using it for a select group of hospitalized patients who have COVID-19. If you use it for a short period of time, generally it's very safe. But there are side effects, mainly cardiotoxic side effects. That means it can affect your heart, especially those who have heart arrhythmias or abnormal heart rhythms, because it prolongs what we call the QTc, and it can cause sudden deaths in people. Again, one of the things that people don't consider is hypoglycemia, as in your blood sugar can go down very low, because the hydroxychloroquine can decrease the clearance of insulin in your body. So your blood sugar can go very low. And again, patients who have psoriasis, it can worsen their psoriasis. It should also be used with caution in patients who have liver and kidney disease. So it's not completely safe. There are some side effects to these medications. That's why we have to be cautious in using them.
Sure. And doctor, is it true that the virus can change and become even more dangerous as it progresses?
In general, as we know from influenza, viruses can mutate as the disease becomes widespread. But thankfully, the SARS-CoV-2 hasn't mutated at all, and that's very helpful because it becomes promising that our vaccines will be effective.
Very good. Dr. Anyimadu, thank you so much for the time today and for all the information.
You're very welcome. Thanks for having me.
Our pleasure.